is Bauermeister, and I'm going to be doing my Foley catheter insertion today. So first, I would go into the room. I have my hair up and my sleeves up, no watches or anything on my wrist. And I would go into the room and introduce myself to the patient. So we're going to say this patient's name is Mr. Jones. So I would go in, introduce myself, say, hi, Mr. Jones. Today I'm going to be doing catheter insertion on you. And it's basically where we just put a tube up into your bladder to help release your urine easier. So then after I explained it, I would ask him to make sure to state his name and date of birth and make sure it matches whatever's on the catheter kit. And then I would provide privacy and do any perineal care if needed. And then I would start. So now I'm going to start the actual process. So I have my catheter kit. I'm going to carefully take it out of the wrapper. I'm going to throw all this away. That's going to be my trash bag. Okay, I'm going to start by opening my kit by the outer 1 inch. Okay, I'm now going to take my gloves out. See, if that were to flip back on there and go back off, that means I broke sterile field, but I'm just going to keep going. So I'm going to put this glove on first. Then I'm going to take the inner cuff of this glove. I would just slip that into my trash can. Now I'm going to take the first sheet, grab it by the outer edges, make sure it is not touching my wrist. And I put it under the patient. Okay, now I'm going to throw away this other sheet. I'm going to throw away my extra swab packet. Okay, I'm going to turn this, place this one right here. So I'm going to take my swab sticks out, put them here, throw the package away. I'm also going to throw this away. And then I would put the jelly on this side of the package, throw that away. Next, I'm going to carefully get the plastic off the tubing without it touching anything else. Throw that away. Okay, then I would carefully put the jelly onto the outer part and carefully set it back in the package. Okay, now I'm going to move this into in between, actually, yes, I'm going to move this. I'm going to switch the places of these. I'm going to put this box in between my patient's legs. Okay, I'm now going to cleanse the urethra in the perineal area. So I would use one swab stick for one side, throw that away. One for the other side, throw that away, then one, and I would start in circular motions closest, and then go away, and then throw that away. Okay, so now I'm going to have one of my hands become unsterile, so I'm going to choose this hand, And I'm going to carefully start placing. I'm going to carefully start placing it into the bladder, and then once I see a flash of urine, I'd put in a couple inches further, and then now that it is actually in, it is considered unsterile, so I'm going to take this out, and I'm going to inflate the balloon. Okay, after I insert the balloon, I would tape this to the patient's leg to make sure it's secure, and then I would hang the bag on the patient's bed securely.